Hey everybody, Elizabeth Nader back with you, Jersey First TV. Tonight is going to be an unusual interview, an unusual time with you tonight. I want to welcome Jaleh Teymourian. Oh, there I messed it up right there. Can you believe that? Within the first few seconds, Jaleh
Okay.
Teymourian,
Very
welcome
good.
to
Thank
Jersey
you.
First TV. So let's first of all pronounce your name better than I did, since I just butchered it. Just say it. It's beautiful. Say your name for everybody.
Sorry, the township is calling me. It's Jaleh Teymourian.
Beautiful name.
Thank you.
And we're welcoming you to Jersey First TV tonight. It's an unusual episode because what we wanted to do is bring you on to talk about some of the pressing issues in this state,
Right.
but to give people a view from, if you will, the other side of the aisle, as we say, right? So I tend to be more conservative leaning. You tend to be more liberal leaning, if we can even use those labels. But we wanted to have some discussion tonight to help people see the balance to issues so that they can understand what their neighbor thinks, what someone in their family thinks, how people see the issues that we're all concerned about. So in order to do that, I first want you to tell everybody about your background, who you are, what you do, so they know sort of what your point of view is.
Okay. I am a writer and filmmaker. I've been in the industry for a long time, over 20 years. And in the writing portion, I've also covered local politics, and through that, I also became a community organizer and activist, and sort of rallied a bunch of people together to become more active in local politics, beginning with the last election.
And you're a mother as well. You have
I am. I have two children. My son is 16, and my daughter is 21.
Okay, so you're right in with the schools and all the things that are going on with your children as well. So we want to start with, I'm just going to hit some issues, all right? And I'm going to just ask you what you think about them, and then I'll give you some balance of what the other side may think and let people sort of discern. Now, everyone that's listening to this, go ahead, make comments, tell us what you think. Here's the thing, Jaleh, the environment we're in, even right now on social media, gets so intense, right? It gets nasty. It gets the vitriol and all of that. But the truth is there are facts on both sides. The truth is there are things that need to be discussed on both sides. And I think to the end that we can do that tonight is good, and continue to have those conversations, because we fix things by coming together. So let's start with something, a hot button. I'm just going to dive right into a huge issue, which would be Governor Murphy's response to COVID. Now, let's look at this past 16 months. What do you think, and what do you believe the other side of the aisle, the more liberal leaning views, the more blue views of Murphy and his response? What do you believe they are?
Well, I think COVID is a very interesting animal because, across the country, you'll see people who lean left politically, typically, who are very much not in a camp that you would necessarily expect them to be. They don't, So I think it's and then on the flip side, there are people who would vote Republican typically, who are very much for a lot of mandates and things that you don't normally see. So I think COVID has been a very interesting issue in that respect. I think if you're going to talk about, mask versus no mask, I think a lot of people are very, they trust Fauci. They trust the CDC and the WHO, and they trust the people who have been trained and not just like scrolling through the internet when they're going to the bathroom, but have actually gone to college and learned, epidemiology and have studied these diseases. When they tell us, okay, so wearing masks will cut the risk of having, of transmitting COVID if you have it, and hopefully will reduce the level of the virus if you are exposed to it. So a lot of us were like, yeah, cool, we're on board with that. I'm going to wear a mask. I'm fully vaccinated, and I still wear a mask when I go to certain areas, just because there's a lot about the new variants that are coming up that are very scary and we don't know about. So, I think that I can't speak for every Democrat, again, because a lot of them are not, too keen to be told to wear masks or, be vaccinated. But for the ones who sort of fall in line, I think, we're frustrated because we feel like just, like this is why we can't have nice things. If we could only just, kind of not draw on the walls of the country and everybody just put your mask on, then we would be able to get through this a lot faster. I do think with no new deaths and the cases dropping dramatically, that we're going to be able to see a lot more freedom for New Jersey residents than, say, Missouri, who is just being ravaged by this new variant. And I have to tell you, I have friends whose very healthy partners and family members, this new variant, they get it, they're dead within 48 hours. I mean, it's brutal.
We're hearing that. I think the flip side to this, I think when you look at the numbers, I think one of the frustrations, Jaleh, has been what is the science? Because sometimes those of us that wonder why we're being mandated certain things, we say, where is the science coming from? And, from Governor Murphy's standpoint, it's not really disclosed what he's using as a metric. The metrics always move. And so it feels like, what is this mandate? And then if you start to dig into it and say, are masks really effective based on what? And I think a lot of Americans do get frustrated when they're mandated to do something. I think Americans are interesting this way, Jaleh, and I wonder if you agree with me. I think when we're told to do something and forced to do something, it feels differently than if someone were to say, hey, this may be a good reason. And so I think the approach has been to force people to do things. And I think right then, you're going to get resistance. But you're seeing a lot of people frustrated with Governor Murphy because we don't understand the source of his data. And it seems like even when you look at the Fauci emails and some things that have been uncovered, it seems as though their inconsistencies make everyone say, wait a minute, what's the truth? And so rather than taking it blindly, we want to know more, right? We want to know, why are we being told to do this? It's questionable.
Well, okay. I mean, I can understand if you feel that there's a lack of transparency with the source of the information, then there's always, you could push for more transparency in that. But I also feel that, unfortunately, that this goes back even further to the whole idea of a virus and sort of precautions being politicized. And that happened at the beginning when it was sort of like, we're going to draw the line here and that sort of, and that was an unfortunate happening, because I think that a lot of this sort of back and forth and people being angry about, wearing a mask would have been taken care of if it had been handled more responsibly and not been made a political hot button issue. Not everything. It's just like, there's not a demon under every rock. Sometimes it's just a rock, and yeah.
Well, I think the personal side of this, when we talk about Murphy and the COVID response, I think everyone listening to this, and I'm sure you as well, we've all had a personal experience with the way he's handled this, for better or for worse. And so, there's a feeling that, all right, his decisions affected the grandmother who died in a nursing home. His decisions affected my children in terms of their experience in school this year, or my friend whose son, unfortunately took his life, or somebody who lost their business. So while I see what you're saying, that sometimes it feels like everything becomes a political hot button or conspiracy, this year has been so incredibly personal. And I wonder sometimes if the cure that Murphy brought us was worse than the actual disease. And so how do you feel when you look at some of the things that people have suffered as a result of the political decisions?
Oh, I mean, personally, I've suffered, and I get it. I totally get it. I think, it's hard because it was such an unprecedented time. We, aside from 1918, we haven't seen a pandemic like this. And I had to tell you, this response was it's not new. It's not novel. It happened in 1918 too. People were rallying against having to do stuff back then too. And I think you were right when you said, Americans don't like to be told what to do.
Right.
We want, to be asked nicely or to be said, that sort of thing. I'm making light of it, but you understand my point. And I think that when you kind of have to look at the whole pie. It's not just, like, did the prolonged shutdown, was that a result of not taking things seriously early enough on the, when they found out about it in January and, on the federal level that it was going to come here? Is it the rollout of the vaccine, the slow of that, like the whole kerfuffle that happened there? What is the genesis of this? But yes, I mean, there are casualties to this. There are, people have lost jobs. They're just barely hanging on to their homes.
Tough stories.
Yeah. Depression, people, all sorts of things that are on the rise that hopefully we can address and kind of move forward from and do some healing now.
Well, a lot of healing needs to take place for sure. I think one of the things that, is still really a hot button issue from all of this is the vaccine. So the idea that a vaccine, which is a medical intervention, is a drug of sorts, however you want to call it, would be potentially mandated. So the idea that government would say to a citizen, you must put something in your veins for the greater good. So now we have, obviously that is a big issue. So I know many people are concerned about that. Many people want the choice. They feel there's risk with this medical intervention and they should have the choice. What would be the argument against giving people the choice of whether or not to use a medical intervention, no matter if they've had it, they haven't had it, no matter the standing of the vaccine, emergency use authorization, all those things. So what is the argument for actually saying to the citizens, you must use the vaccine, you must take it?
When we have other outbreaks of highly infectious diseases, we quarantine people, we put them in isolation wards. We don't give them the option of not, not participating in their care by saying, no, I'm not going to come to the hospital. Or they, quarantine people at home. I mean, this is not, it wouldn't be the first time. I mean, you have to look at like typhoid. We had, Roosevelt Island was Brothers Island, and that's where we would send. I mean, there's always been, for the general health of the population, the idea that, sometimes you're going to have to just sort of acquiesce. Now, having said that, I don't know that that's going to happen. I don't know that I see that happening. I don't know that the government is going to be able to get that passed, but I'm just saying that it's not anything that we haven't seen before.
I think some of the things you're referring to valid, but had more to do with the sick people, right? So the people that needed to be quarantined. And I think historically, we tended to quarantine sick people. We tended to quarantine those who were at risk. This has felt very much like a universal solution for everyone. And so we shut down society and we shut down businesses and we shut down schools sort of across the board. The things you're referring to, I think, have been applications for those that were infected or those who were at risk. I think some of what we're getting at here is maybe a lack of personal responsibility. I like to think that I would make a good decision as a New Jersey resident, that I would make a healthy decision, that I would know, what's good for me in terms of what I would be willing to expose myself to. It felt this year as though those were decisions were taken from me. So, and part of that, I just want to see what you think about when we look at the political atmosphere, because that's who was making the decisions. We really have one-sided. So we have one party who's in control. Do you kind of see how people would start to feel as though it is all political when the decisions are being made really by one man and by one party?
Yeah, I mean, I see that, but I think that that's an unfortunate point of view because, again, this isn't the first time that we've locked down cities. I mean, Philadelphia was locked down after, the Spanish flu epidemic started. I mean, in 1918, we locked down this country. We totally locked it down, and it was very similar, except that we just didn't have the medical advances we have now. So we're very fortunate in that, like, whether my personal opinion is that they were able to come up with a vaccine so quickly so that we can sort of start getting back to some sense of normalcy. Yeah. And as far as quarantining, the sick people, yes, we did that. And we also quarantined people who had been exposed to those people. So, and here in this last year, we relied sort of on the honor system and told people you're going to have to self-quarantine at home, which was different than, shutting them up in their house and putting a Board of Health notice on their door saying this, you can't come out for X number of days.
Right.
So, again, I think that a lot of, that if it's going to be an issue with, infringing on personal rights, then I don't think that anything that anybody tells you about the greater good for society is going to make a difference. I think that that's something that you kind of have to, you have to have your own come to Jesus moment on that one.
Okay, so let's talk about it related to the children. So we've had a COVID response related to businesses, related to adults, related to, we know what happened in the nursing homes, which was very unfortunate, but specifically to children. Now, again, I think science, a lot of people would say, please use the science because science shows that children are not really affected by this virus in any grave way, certainly not in the same way that the adults were when it spiked last spring. So yet we closed schools and we had children suffering from home. Public schools closed, private schools stayed open, which is interesting. Not all of them, but it was a mix, right? Mm-hmm. And so we've had children really, really suffer. I think one of the things that's going on in this state is parents are feeling very out of control. They're feeling like they don't have the ability to affect what their children experience in terms of school. And we'll get into some other details on that. But related to the COVID response and children, do you think that was necessary? And how do we do this again next year? Because, COVID's not going away, right? I mean, it's something that they tell us will be around just like the flu. Did we overreact with the schools?
On some levels, maybe. But I think that to say that children aren't as affected by COVID is, it's a little too broad because kids with each new variant, they're showing like younger kids will be affected. And when they did recover, they may not be as seriously ill, but then they have these really freaky, weird, long-term, the long hauler, symptoms that, and sometimes it's neurological, sometimes it's, but they're suffering as much as adults who are recovering and having long-term issues are. So, and then there's also the option of if they're not going to get as sick, they can still carry the virus and they can still bring it to school and, infect an adult who would then in turn bring it home and, maybe to a sick parent. Like I had, on a personal level, my youngest kid who was a sophomore this year, it was weird. And basically first half of his freshman year of high school, he's home. He was scared to go back to school because he has really bad allergies and asthma. And he was afraid that if he, was exposed to the virus that he could get, and it's true, he could have gotten really sick. And if he had brought it home, I had no idea that I had, cancer until I was diagnosed. And that could have been very devastating to me. I mean, luckily that's all fine now, but there's things that you're not always, you don't know 100% what's going on in your body. So like me, I was like, oh my God, I had no idea. And that could have been really bad. My son did go hybrid for a while and he hated it. He was like, I'd rather be home, quite frankly, because it's really depressing. And I agree. I mean, we need to figure out what we're going to do going forward, because I don't think we're going to not see pandemics anymore. I think this is just sort of a harbinger of things to come. Like the environment, everything's changing, and we're going to see more sort of super bugs. And how do we have a response in place that kind of locks everything down and quickly enough and contains it in a small enough, package that we don't have to do the crazy shutdowns, that sort of thing. Do we come up with apps that, tracer apps that people, use? I mean, there's a whole several conversations that need to happen on what do we do to protect kids going forward, and the people who work with them, who are working with our kids.
Sure. And I think the balance always needs to be to, again, personal freedoms and civil liberties, because even when you say tracer app, see, that sort of makes my heart race.
I know. And that makes me nervous too. I mean, the idea that there's certain things that, like, how much of your freedom are you willing to sacrifice for safety? I mean, and that is something that every citizen's going to have to weigh for themselves.
Right. We need to weigh that. And if government's making decisions like that, and should they be, they need to weigh it. And again, it comes back to, I think science has been really bastardized in terms of a word. I'm not sure that we really know anymore. And we're going to need to reset that table. What really is science? Because it hasn't, the politicians have not been transparent about what they're using. And so people making decisions who aren't scientists, people who are making decisions about our lives who aren't sharing the data. And there is a lot of disagreement over a lot of the things we've said tonight in terms of what is truth. What actually, how does this virus affect people, and who does it affect? And as of yet, I don't believe that there's hard and fast agreement to that. And so that's a problem too, when you're making public policy decisions from a set of data that maybe people don't agree on. So the schools are an issue, and schools are a huge issue now. You're even seeing this summer with a lot of the response of parents to certain curriculum being taught. And so it's been several things. They wanted the schools open, as you know. Then it's been a lot of conversation about the children being masked. And then we've had just recently a lot of pressure and people showing up in Board of Education to talk about curriculum. This really, again, Jaleh, comes down to parents and their ability to have a say on how their children are educated. What is the balance there? If somebody wants to say, I don't want that taught at school, I want to teach that at the kitchen table. And then we've got government coming down with policy that says your children will be taught this. So where is the balance, and what is fair for a parent?
Okay. Well, to circle back around to let me just touch on a point you made earlier about COVID before we move into this. As far as not having all of having a sort of like a cohesive response, this virus is so novel and new and is so weird in the way that it affects people that, I think everybody, scientists, doctors, everybody was learning on the job. And, so, that I think is unfortunate, but I think, now hopefully we won't decimate, pandemic response teams. We will fund research into how we can manage these kind of, situations. Now about schools, here's the thing. If you're gonna, so people don't email me nasty things.
No emailing nasty things to either one of us. That's part of tonight. Is we're doing this in a good way. Yes.
So look, I think what you're sort of referring to is the idea that there's a lot of people that are really pissed off about the idea of teaching what they call critical race theory. And quite frankly, I'm not. That's a high academic, sort of like a higher level academia qualification. I think that it's, again, been politicized, but the idea of letting people know the good, the bad, and the ugly of our history isn't racist. It's saying, hey, we did these things. And as I said earlier in a private conversation, that if you don't learn from history, you're bound to repeat it. So do we not want to teach our kids about some of the things, do you honestly want to not teach your kid about some of the issues that have affected not just people of color, but let's say the Irish people who came over? Like my family was Irish and they were treated like trash because there was a bias against the Irish. I mean, there's always been a fear of the other throughout the world. So as far as that whole teaching the race thing, I don't think telling somebody, a white kid, that, okay, so because of the geography, like you wouldn't complain, like, as I said, if you had a kid from Alpine or Short Hills or Mendham, and you just sort of accept that through the geography of their birth and where their family is located, they are in a more privileged position than, say, a kid born in the airport slums of Mumbai, or a kid born in war-torn South American countries, or a child born in sort of Newark to some extent. So to say to a kid, there is privilege in your life, it doesn't mean they should feel that they, bad about it. It just should be aware of it. Like, my life is different than my neighbor's life, my who's a person of color or whatever, because I don't have the same experiences. And I think that is part of like this conversation we're having is, like talking about the experiences that we've had from different points of view. And that can be, it can fall under the same things with race or religion, anything. It doesn't mean that your child's going to be indoctrinated. It hopefully. Well, and if it does, it shouldn't. You should definitely raise a stink, because that's not, church and state, first of all. Right. And that's for a good reason. Those guys were smart. But I think
that way though, Jaleh. I think just that word indoctrination, I think that's the feeling and the fear. And I think that where people really can agree is teaching history. Now that's really important. And I think we've seen in this past year as some history being erased, unfortunately. And, we can say to that that's not okay. Statues being removed and history that needs to be told. But the sense that there would be guilt over what race you are or what your ancestors did or did not do, I think the fear that parents have that needs to be addressed is that their children are going to be made to feel that way. And when we look at children, they sort of inherently aren't racist, right? They're very pure in that regard. It's what we teach them that matters. And so while this has been dealt with primarily in the home, I know parents are concerned with that as well as the sex education, because now we're having via laws from Trenton, certain curriculum in terms of sexual education that starts as early as kindergarten. There's another area of concern where parents would say, okay, that's my purview. I choose to teach my children what I want to in that arena, especially at a tender young age. So the concern over that is it's much too young and it's something that parents should do. What is the balance to that for people that you've seen that support teaching children that young some of this really, and what we think is intense sexual education?
Well, again, first of all, in terms of erasing history, I don't think, bringing down statues of people who were traitors to this country, who lost a war, the Confederates, I don't think that's erasing history. We still talk about them. We still teach about Robert E. Lee, and we still teach about all of these, how the Southern states and how the Civil War started. They're not going to be erased from history. Glorifying them, that's not so bad. They can go. That's not I have no issue with taking down Robert E. Lee. It would be like if we decided like next week we're going to put up a statue of somebody that I'm trying to think of what, like some Iraqi jihadi. And it's, like people get pissed off because we're going to take that down. They lost the war. Why are you glorifying them? That's my thing. Okay. But as far as sex education goes, what the NHS did, not the NHS, sorry, that's the National Health Service in the UK. The NIH, the National Institute of Health, released a study that showed 93% of parents are, regardless of political affiliation, are on board with some form of sex education. I don't, not as early as kindergarten, clearly, but in middle and high school. And I think, you teach what's age appropriate to the kids, but I think, when you see that there's a consensus among people who identify as both Democrat and Republican, that they want topics like puberty and healthy relationships and birth control and abstinence taught, so that they want all of that taught. And even some a strong majority of this study of Republican parents wanted they wanted gender and sexual like identity taught as well. And there is some level of parenting that is really uncomfortable for some people. They're not going to have that conversation. Look, I thought I was dying when I got my period because my mother didn't tell me anything about it. And when she told me about sex, this was the conversation we had. About, don't you? And I was like, yeah, I know. So that's nothing. I mean, I had no idea what was happening to me. And that's, maybe those parents would have been more comfortable had there been, and there was sex education for me. And I, finally figured it out, but it came a little too late after I was sure I was dying. So, puberty is happening younger for kids, not kindergarten. But so, we've got to sort of like look at that. And there's also the option, I was given the option here to not have my kids sit in on to opt out, which, right. Okay, that's fine. But I think if you're just going to, personal opinion, if you're just going to rely on abstinence only education, you're going to end up with a bunch of pregnant kids who don't know how they got pregnant.
Well, I hear that argument, but I think the thing that concerns a lot of parents is that they want to tell their children what they want to tell them at the age that they want to tell them. Now, our ages are probably similar, and we had
they are.
Okay, we had the classes that we had, but we certainly weren't talking about some of these issues as young as now they're mandating it. And I think you're correct in saying not every home provides the same amount of love and care, support, and information. But on the other hand, to be forced to have my child sit through that, and in some cases opt out, feels like that's an option, but not always. And the way the curriculum is now being taught, it sort of shows up in different areas. And I think that people are rightfully concerned about what is kitchen table and what is the school table, and that line becoming blurry is scary. And, we've seen things that are extreme. And I think that discourse needs to still happen, is what is appropriate and what is not. And again, here we are again, we're dictating from the politicians, right? We're dictating education from Trenton. And is that the right way to do this? Where now Trenton, when I say that, of course, I mean all the politicians are so involved in our lives. Again, where is personal responsibility and personal choice? So this issue about the schools, I think you're only going to see it get more intense over the next few months. And it's, going to continue to be something that we're going to hear parents talk about. And we'll continue to see. And at some point, it will show up probably from a policy standpoint. Let's move on to another part of education, which would be higher education. A frustration for people that Murphy now is, supporting free college, free tuition. It's for certain income groups and all of that. It seems to be sort of geared towards certain ethnicities or certain statuses in terms of immigrants. And it's frustrating for people who pay for college. It's frustrating for people who have college debt, who have done everything they thought that was right, and they have college loans. And now there is this free tuition. So what is the other side? What is the argument towards offering this? And is this really a right to have college for free?
Well, I mean, when you talk about right, let's look at some underlying factors. First of all, it's community college. So it's 2 years, but there's also studies that show that people who go and complete 2 years of community college are more likely to go ahead and finish the 4-year degree, which would mean that we have more people in New Jersey who are college educated, which would be a more attractive workforce to bring business into the state. And to retain young people who are leaving because it's, this place is crazy expensive. But when we look at college in terms of should everybody go to college, when I went to college, and I'm not that old, the cost of tuition is now more than like 163% higher than when I was in school. And, you know, that is not sustainable for people in my area. And I live in a very wealthy area. There's kids here who work their butts off to get into really great schools and can't go because they don't get enough financial aid. Now, here's, you know, and so they take, you know, in terms of, and the parents just aren't willing to take on those loans of, you know, basically a mortgage for when their kid graduates, because then what if they want to go to graduate school, that kind of thing. Right. So those are hard conversations that we on, you know, in the upper income bracket are having with our family, which, you know, we've done it right. We set aside money when our kids were born. We started saving. We've put things in, you know, Roth IRAs. Thank you, Rosemary. And all of these savings plans, and it's still not enough. And what's the benefit that we're getting? We're getting administrators at the universities who are being paid hundreds of thousands, if not millions of dollars a year. For what? To have our professors be furloughed or to be put into a part-time position. We have no more, you know, so we're ending up with like commuter colleges at these four-year universities because these administrators are getting fat and happy. So that's an issue, like in terms of dealing with, we have to do something about tuition. It's crazy.
I agree.
It's not sustainable.
That is not sustainable, right?
In terms of, I mean, you hit on a point, which is it's only for people who make under $65,000 a year, which in New Jersey, we have a really high number of families that live below the poverty line who the parents work full time. You know, they work full time, and this speaks to minimum wage, and they're college educated. So because more and more jobs, you know, you're looking at jobs that used to be something that you could get in high school as an after-school job are requiring college degrees. So how are people going to support themselves, even if they're going for minimum wage jobs that now are saying, oh, we want to see a degree? How are they going to do that without at least an associate's degree? And in terms of providing education for undocumented immigrants, you know, yes, it does provide, you know, tuition for them. It comes out to about 17 cents per resident of New Jersey to educate like this approximately 600 people who are attending these state universities. So I mean, the thing is, like, if we educate people, we're going to have like a much more innovative state. It's going to be attractive to people, and we're going to have people who can, you know, then I don't want some, I want people who can take care of me when I'm old, who aren't morons, basically.
Okay, well, we don't want morons, but
no morons.
But here's the thing: is that, and we're gonna actually end on this because you and I have so many other things we can talk about. But so many things come back to who's paying for stuff, who's paying for this. And I think there's that from already so highly taxed in this state, property taxes through the roof, the sales tax, which is going to go back up. Who's paying for everything? And I'm not really asking you that question because it's sort of out there as the question du jour. And I think it gets old for a lot of people that once again, here we go, a free program. Who's paying for this? And really, when are we going to get a hold of the economics in this state and make it a livable? You mentioned earlier, kids leaving after college or not even going to college because they can't afford it. So, shouldn't we be fixing the affordability of the state before we're offering more and more programs to people? Then we have to tax more and more. We've got to get a hold of the spending. And I think in large part, we can come together. We can come together from both sides of the aisle to say what is important there, because you want to continue to live here. I want to continue to live here, and it's getting out of control. So, when your budget at home gets out of control, you cut, and so do I. And so at some point, I think we have to agree, as to how we can actually make life affordable in New Jersey. But here's the thing, Jaleh, I appreciate you. I appreciate your viewpoints. I definitely don't agree with all of them, but the great thing is that we can talk about it.
Yeah.
And you know what? At Jersey First, this is really about loving the state, and it's really about coming up with common sense solutions to problems. What we want to be able to do is we want to have the both Republicans and Democrats come on this show together. So to the candidates and the incumbents out there, Jaleh and I want to provide a platform for you to have really fair and balanced debates about all of these issues. As you guys are running here for either re-election or to unseat someone, we will be talking to them about coming on the show, and Jaleh and I can provide that balance for both sides in a really great environment so that people can understand what you stand for. We can talk about it without vitriol. We can talk about these issues without feeling like we are jumping on each other, because at the end of the day, we really all ultimately want good solutions out of Trenton, and we want good lives in New Jersey. So Jaleh, don't you think people should come on with us?
I do. I think they should. You guys should come and talk to us.
Yeah.
We won't bite you, promise.
We won't bite you. And listen, the local level, the state level, wherever it is, we are welcoming you to come on anytime between now and the elections in November. So thank you, Jaleh. There's so much else we could discuss.
Oh, I know. We could go for hours.
Hours and hours, but I appreciate it very much.
Thank you for inviting me on.
Absolutely. And next time I won't butcher your name. I promise you. I'll work on it.
Yes. I will hold you to that, Elizabeth, or I will be very personally offended.
I know. Offense abounds everywhere. We are on social media after a while, so we might as well both be offended about something, right? Because that's what we do. No.
At this point, I've lived with this name my whole life. I've heard every iteration. It's fine.
It's beautiful. It's beautiful. All right. Thank you for coming on. We'll do this again. And to my audience, guys, you may hear a lot of things tonight you agree with and don't disagree with, but just keep thinking, because when we all come together and think, we can solve things. Jaleh, thank you so much. To my audience, guys, we will see you guys all next week. Have a good night.
Bye.